Good morning, everyone. Thank you for that introduction, April. I'd like to welcome everyone to today's webinar. This is the first in a series of 3 that we will provide this month. Today's presentation is covering billing for conversations about tobacco use. Again, my name is Shannon Vaffis, and one of my roles here at Ashland is on the referral development team. I partner with behavioral health organizations and professionals here in southern Arizona. Before I begin, I would like to cover a disclosure statement. Neither I nor the Arizona Smokers Helpline have an affiliation or a financial relationship with any of the organizations or entities with a financial interest in or in financial competition with the subject that we will discuss today. Today we'll have an ambitious agenda. We'd like to begin with an overview of Ashline and the services that we provide. Touch briefly on the Ask, Advise, Refer model for conversations about quitting tobacco. We'll look at what the Centers for Medicare and Medicaid Services cover in terms of these quit tobacco conversations, the providers who can have them, and the settings in which they can occur. We'll talk about billing codes for quitting tobacco use counseling, and then look at some examples of these conversations in action. And today's webinar will just provide some highlights of the Ask, Advise, Refer model and the covered services for Medicare beneficiaries. But for more detailed information, you can contact your Ashline Referral Development Coordinator, and we'll provide contact information for our team at the end of today's presentation. So, in short, Ashline is free help for all Arizonans to quit tobacco use. We offer several different services or programs, the most popular of which is coaching over the phone. That's a one-to-one relationship that a client develops with a coach. They have phone calls over time to develop a quit plan and to stick to it. And people who enroll in the coaching program are usually eligible for a medication assistance benefit, which is 2 weeks of nicotine patch gum or lozenge. We also offer a similar program online, but it's self-paced, so a user creates an account and logs on, again, over time to develop a quit plan and then track their successes and stick to the program. Some of the other services we offer are for healthcare systems and professionals. We will touch a bit on our referral program, as well as some of the technical assistance and training resources that our referral development team can provide. We get our funding from the Centers for Disease Control and Prevention, as well as a portion of the state's tax on tobacco products that comes to us from the Arizona Department of Health Services Bureau of Tobacco and Chronic Disease. We are housed at the University of Arizona in the Mellen Enid Zuckerman College of Public Health, and we've been here since 1995. Our mission is to improve the health of Arizonans by providing client-centered tobacco cessation services through technology-based interventions. Now, to provide an idea of the size of the potential patient or client population that these quit tobacco conversations might apply to, I'd like to take a look at some statistics on tobacco use in Arizona's adult population. According to the most recent Behavioral Risk Factor Surveillance System survey, the prevalence of tobacco use in Arizona was 13.5% for adults, and we actually do fairly well here in Arizona. We have the 4th lowest prevalence rate in the nation. We are just behind states like Utah and California for tobacco use. However, as we'll see, there are still some pockets of folks in the state where tobacco use is much higher than the state average. If we look at smokers among the Medicare population nationwide, we see that there's an estimated 4.4 million tobacco users. So there could still be a significant portion of Arizonans who are on Medicare who are also tobacco users. In addition, it's estimated that up to 75% of Arizonans with a mental illness use tobacco. So just highlighting that there are some pockets within the state where tobacco use is much higher. Now, you may wonder whether conversations about quitting tobacco will fall on deaf ears. And I will cite a number of statistics from the U.S. Public Health Service Clinical Practice Guidelines. Treating Tobacco Use Dependence from 2008. This is now in its third edition, and at this point, the editors have reviewed about 10,000 scientific articles. So these statistics come from that guide, and if you want a short version of that guide, the executive summary, you can click on your 3 papers icon on your toolbar at the top of your screen. But the guidelines state that at any given point, about 70% of tobacco users are thinking about quitting. That doesn't mean that they're going to quit today or tomorrow, but they're processing this. They're in the stages of perhaps getting ready to quit. And 40% of tobacco users will try to quit this year. The unfortunate statistic is that only about 3% of those folks will be successful at a year without any form of assistance. So these are people who would quit, what we would traditionally call cold turkey. But the guidelines have found that two interventions are really shown to be effective in helping tobacco users quit. The first is counseling, or we might call that behavior change support, and the other is quit tobacco medications, either of which is likely to double the chance of success of being quit at a year. And both of these interventions have a place in the Ask, Advise, Refer model for quit tobacco conversations. And advice from a health professional is an important motivator to quit. It increases the likelihood that those folks who are thinking about quitting will move to making a quit attempt by 30%. So knowing that so many tobacco users are thinking about quitting, it's important to connect patients or clients to resources that are shown effective in helping them quit. Not only do conversations about tobacco use have the ability to incorporate information about counseling and medication, but a referral to Ashline can provide tobacco users with that support and medication assistance. So let's look at the Ask, Advise, Refer model for conversations about quitting tobacco. The first step is to ask. Ask every patient about tobacco use at every visit. We have a very broad statement here. How much tobacco have you used since our last visit? And the reason we like this statement is because it incorporates all tobacco users. When you say, do you smoke? You're going to capture a certain portion of the population. But when you say, do you use tobacco, you're capturing chew tobacco users, of which we have a significant population in Arizona, also hookah users. So this is much broader. And by saying, how much have you used since our last visit, you're also able to capture recent quitters. And recent quitters can be supported from the same kinds of interventions that folks who are thinking about quitting can be supported by. So it's important to capture all those folks and give them the tools that will help them create a quit plan and sustain it over time. The next step is advise, and that's advise all tobacco users to quit. Again, we have a very broad statement here that quitting tobacco is the very best thing you can do for your health. But in this advise piece, If you know a patient or client well, this is an opportunity to personalize the message to their reasons for quitting. You may know that this person is motivated by financial reasons to quit tobacco. You could incorporate that into your conversation. Perhaps they're in your office because of a health concern that would benefit from quitting smoking or be improved by quitting smoking, so you can bring that into the conversation. Advise is also a step when you can discuss whether or not a quit tobacco medication is a good option for that person and which of the 7 FDA-approved medications it might be appropriate for them to use. The last step is refer, and this means to refer a client out to an evidence-based program for quitting tobacco, which Ashline is. I'd like to note that the Public Health Service guidelines do show some evidence that sharing the work of tobacco counseling may actually increase the effectiveness of the intervention. So we'll see some examples later in the presentation that demonstrate how a team of health professionals can actually share the steps of the Ask, Advise, Refer model. And CMS makes it easy. They are willing to reimburse for these conversations about quitting tobacco use. CMS currently covers claims for both inpatient and hospitalized beneficiaries who are tobacco users, who are alert and competent at the time that counseling is provided, and when the counseling is provided by a Medicare recognized practitioner or qualified physician. This coverage began January 1st of this year. Prior to January 1st, coverage was only provided for outpatient services, and the patient had to present with symptoms incident to or be diagnosed with a tobacco-related illness. An ICD-9 diagnosis code was submitted with one of 2 CPT codes. 99406 was for tobacco use counseling of 3 to 10 minutes. And then 99407 was for tobacco use counseling greater than 10 minutes. For a list of ICD-9 codes of tobacco-related illnesses, you can visit the American Academy of Family Physicians at their website, which is aafp.org, or you can view this list in the handouts section of today's presentation. Again, that's in the 3 papers icon. So now, coverage is provided as of January 1st for current tobacco users, even those who have no symptoms related to tobacco illness. It covers both inpatient and outpatient settings. Additionally, CMS will cover 2 different quit attempts per year, and each quit attempt could have up to 4 counseling sessions with a healthcare professional. So each beneficiary is now eligible for up to 8 counseling sessions with a healthcare professional each year. Physicians, non-physician practitioners, and other healthcare providers who are enrolled in the Medicare program are eligible to receive these Medicare payments for covered services provided to the beneficiaries, and we have some examples listed here. And I'd like to note that although respiratory therapists are not considered Medicare recognized practitioners, they can provide tobacco cessation counseling incident to a physician's professional service, and often this is where standing orders to have a respiratory therapist do this quit tobacco counseling come in. We will look at some examples of that later in the presentation. But for more information about CMS coverage, I would refer you to the Medicare Learning Network document, which is in the handouts section. And the Public Health Service does recommend that a facility have a designated person or department to monitor the tobacco cessation counseling program or services. This helps ensure quality and consistency for all patients across a facility. Many staff can provide counseling, but it's important to have a designated person or team to monitor how tobacco policies are implemented or how they're functioning. This also helps ensure sustainability. By going through the effort to develop policy and train staff to provide tobacco cessation counseling, you want to protect that time investment by making sure that there's a team to keep the project operating at maximum efficiency. And one of the ways Ashline can assist your facility is through some ongoing reporting for referral outcomes. So let's look at some examples of this Ask, Advise, Refer model in action. Again, Ask, Advise, Refer is 3 steps that can be built right into the clinical workflow. First, we have ask every patient about tobacco use at every visit, advise all tobacco users to quit, and refer to an evidence-based cessation program. So we'll look at an inpatient scenario, an outpatient scenario, and then the billing codes that would be used in each. So in our first scenario, we will cover inpatient. Our patient's name is Joe, and he has presented with acute chest pain. Joe decides to bring himself to the emergency department because he is experiencing acute chest pain. The nurse checking his vital signs is asking him, do you use or have you used tobacco in the last 30 days? So here we see that the ask piece is built right into the vital signs, and that's key because it is ensuring that all patients are going to be assessed for tobacco use in the same way. Joe responds that he does currently smoke, and when the physician visits with him, he diagnoses Joe with myocardial infarction. He says, I see that you're a tobacco user and that is unhealthy for your heart, so are you interested in quitting? This is where the advise piece comes in. So Joe says yes, he's interested, and the doctor discusses with him some medication options to help him with his cravings. Again, there are 7 FDA-approved medications. And then the doctor says, I'm going to have one of our staff come talk with you about free resources to quit. And he arranges for a member of the respiratory therapy team to stop by and visit with Joe. So here's an example of how a physician can have orders for an RT to come and do this counseling, and thus it would be covered for the RT to have this conversation. So the RT visits with Joe to review what the doctor has said and then offer him a referral to Ashline so that he can get some further assistance with medication and support. So Joe agrees and provides his consent. Now, referrals to Ashline can come in several different forms. We have paper referrals that can be faxed to us, and those paper referrals can be personalized to your organization or facility. And if you're interested in that, you can contact your referral development coordinator. We print those forms and provide them for free. You can also do online referrals through our WebQuit portal. Again, that's a password-protected account that your referral development coordinator could set up for you. Staff could log on and make the referrals online. Or you could incorporate the referral into your electronic health records. And through these conversations now with his healthcare team, Joe has been provided with the 2 things that are most likely to help him succeed in quitting, which are, again, behavior change support and quit tobacco medication. And the following billing codes are submitted: an ICD-9 code, in this case for myocardial infarction, and then the CPT code, 99407 because we're assuming in this instance that the tobacco use counseling was greater than 10 minutes. Looking at our outpatient setting, our patient's name is Melissa, and she has an ingrown toenail. Now, what's great about this scenario is that an ingrown toenail is not something that a patient would present with that you would naturally think of talking about quitting tobacco. So we'll see how that can be incorporated. Melissa has scheduled an appointment with her nurse practitioner because she's in pain and needs to see someone quickly. As the medical assistant is taking her vital signs, she asks Melissa about tobacco use. So again, the ask piece is built right into the vital signs. Melissa shares that she used to smoke, but she quit, so the MA congratulates her and asks how long that's been. And Melissa shares that her last cigarette was several days ago. So this is a great example of how a recent quitter is captured by the tobacco use question. And as we know, recent quitters can benefit from those same interventions as tobacco users. So when the nurse practitioner sees Melissa, who is experiencing some throbbing pain due to that ingrown toenail, she arranges some services to treat her toe and then comments, "I see here that you quit smoking. Congratulations. How's that going?" And this is where the advice piece will come in. And Melissa admits to having some withdrawals. So the nurse practitioner asks her if she would like some free support, and Melissa says not at this time. So while a referral didn't happen, this is where it would occur. At this point, the nurse practitioner might also choose to offer some free patient resources like a card with Ashline's 1-800 number in case Melissa would like to call for more information or support after she leaves this appointment. But in any case, the nurse practitioner makes a note to follow up with Melissa about her quit attempt at her follow-up appointment, and she'll be able to bill for that conversation about quitting tobacco at the follow-up visit because, remember, up to 4 sessions are covered per quit attempt and 2 quit attempts are covered per year. And then she submits the following billing codes. ICD-9 for personal history of tobacco use and CPT 99406 because this conversation was very short. For almost a decade, Ashline's referral development team has specialized in helping healthcare organizations in Arizona meet the Public Health Service guidelines. We offer free resources to help your organization meet their tobacco cessation goals, including an assessment to figure out where you are in terms of policy development and tobacco cessation goals, assistance with developing some policy, training for staff, and as I mentioned, some reporting for referral outcomes. And we have referral development staff who specialize in assisting both medical and behavioral health professionals. So if you have questions or would like more assistance in developing a quit tobacco workflow, you can contact your regional referral development coordinator. On our medical team, we have 3 team members. Connie Diaz is in Central Arizona, which covers both La Paz and Maricopa counties. Jennifer Hernandez serves Northern Arizona, which is Gila County and everything north of La Paz and Maricopa. And then Ryan Murkowski serves Southern Arizona. On our behavioral health team, we have Karen Aiken in Central Arizona, which is mainly defined by Maricopa County, and I serve primarily Southern Arizona, but will assist behavioral health organizations from across the state. You can reach our team through the phone numbers on these slides, or just by calling our toll-free number, which is 800-556-6222, and be directed to your referral development coordinator. Now, before we close and take questions, I would like to share information on our 2 upcoming webinars. Next Thursday, the 11th at 10:30, We will discuss new standards in hospital accreditation and how Ashline can assist your facility with compliance. And the following Thursday, the 18th at 10:30, we will discuss meeting your electronic health record, or EHR, meaningful use measure sets by partnering with a tobacco cessation quitline. Thank you for participating in today's webinar. I will now turn it back over to April, who will moderate questions.